Welcome to Barnet Youth Live first ever Q&A. I'm Tani and I'm the Member of Youth Parliament for Barnet. And in today's event, we're focusing on tackling the myths and rumours that are about COVID-19 and the vaccine, especially as it's been a whole year since the pandemic and lockdown started.
I'm Nick Dattani and I'm a GP and clinical lead for the commissioning group.
Hi everyone, I'm Dr. Elliott Roy-Highley. I'm a Public Registrar currently working with Barnet, and I've also been doing a stint with the London Coronavirus Response Cell, which tries to track down some of the new variants.
So Boris Johnson said that we can lead a normal life and that we can socialise properly, hopefully the 21st of June. Now, is it an actual date or could lockdown still be extended?
So this is a really big question, isn't it? We have to just rely on what's announced in the news, what's discussed in Parliament. But I think we're confident that things will rapidly get better. But I think the only way that we can do that is by doing three things at the moment: keeping ourselves at home and safe and not meeting people and breaking restrictions while they're on, wearing a mask when going out in public, and going for a COVID vaccine when we're invited. And hopefully some of us have started to think about summer holidays. And I know this is a really hot topic. I certainly want to get away and get some vitamin D and some sunshine. But if we're going to get there, we have to be safe over the next few months. Otherwise, all the hard work that we've done is going to change those dates and move them further along.
Why has there been so much media about Black, Asian and minority ethnic communities having higher rates of infection? And this is due to the ethnic makeup. As a person of colour, would I be more inclined to get COVID-19?
So this is a really good question, and it's really quite complex. The reason why you might have seen a lot of this talked about on social media and in the news is that when COVID was first hitting, we started to see that some groups were more affected than others. They were turning up in the hospitals more, they were needing ventilators more. And we noticed that Black and minority ethnic groups tended to get more severe COVID. And quite a lot of research was done to try and figure out why this might be. When you ask, is there something genetic that might be causing me to be more at risk of COVID, more at risk of getting it, or more risk of severe disease? That doesn't really make sense when you've got a group who are also different. So we really need to try and think about what might be the same between these very different groups that mean that they're more likely to catch COVID, and it's more likely to be worse if they do. So what this really comes down to is structural racism, and it's about the fact that people in Black and minority ethnic communities don't have the same chances in life, the same advantages as white people, and this means that they are more likely to get sicker earlier, more likely to not have the opportunities that mean that they can live healthy, active lifestyles, or more likely to be in jobs which put them more at risk. And that means that when they do get COVID, it tends to be more severe. There is a question here, Nick, which is, has there been any talk about teens and children receiving the vaccine? And the next one is related as well, and that's, will young people in the future need the vaccine?
Teenagers are set to be prioritised for the COVID-19 jab if the government decides children should be vaccinated in the battle to bring the virus to bay, I guess. But there's research which is currently underway to confirm that the vaccines are very safe and effective for children. If it does turn out to be necessary to immunise children, I think it's more likely that they're going to prioritise teenagers over younger children, simply because the evidence we have at the moment is that the transmission of the virus is more likely to occur from and between teenagers who are being a little bit more like adults. The rationale for vaccinating particularly older children and teenagers would be to reduce transmission and protect them from when they become older, I guess. And there's a big study going on certainly right now with the Oxford AstraZeneca vaccine in younger age groups. And I think the results are supposed to be coming out probably, I think June sort of time. So watch this space.
I have a friend who had the vaccine and reacted to it. This has then put me off. What will happen if I choose not to get the vaccine?
Like all medicines, vaccines can cause side effects, and most of them are mild and short term, and not everyone gets any side effects. So even if you do have symptoms after your first dose, you still need to have the second dose, although you should get good protection from the first dose. Having the second dose will give you longer lasting protection against the virus. So what are the most common side effects? Well, you can have a bit of a sore and painful or heavy feeling or tender arm where you've had the injection. And this tends to be worse for the first 1 or 2 days after the vaccine and then settles down. Some people can feel tired or a mild headache, or they might have a sort of a mild flu-like symptom or a general body ache, again, lasting a day or two. Now, although feeling feverish is not uncommon for, 2 days, a high temperature is unusual and may indicate you have COVID-19 or another infection. So that's really important. If you do have an actual fever, then you should speak to your GP. The likelihood of long-term side effects are really rare and they're not something for you to be worried about. And what I can say to you is that if you were to get COVID and become unwell, the chances of you getting something more complicated and dying are so much higher than you getting a rare side effect in the long term from the vaccine.
I've heard that there are variants of the virus. How serious are they, and do we have vaccines to cure these?
So yes, there are different variants of the virus. You might hear them as variants or mutations. I think the first thing here is what are we actually talking about when we talk about a variant of the virus? And viruses all the time are making loads of copies of themselves. And just like if you were copying a picture, sometimes you make small mistakes, and a lot of the time that small mistake doesn't really change how that overall picture looks. And it's the same with viruses. They're making so many copies of each other. A lot of the time it doesn't change how the virus really works, and it's pretty much the same virus. Every now and then, one of those mistakes in how the virus copies itself changes how that virus functions. And the ones that we worry about more are those changes in what's called the spike protein. That is the part of the virus that locks on to the cells within your body and allows the virus to get into your body. The reason we worry about those is if you change that way that the virus locks into your body, it can make it easier to get into your body, or sometimes it can make the virus more dangerous. The other reason we worry about that is that when we give a vaccine, we're teaching the body what that lock looks like so the body can avoid it. And if the change is big enough, it means that sometimes those vaccines will then no longer work against the virus. That's why we get worried about these variants or mutations. There's a few of them. The one that you might know the best is called the Kent variant. So that was the one that just before Christmas started to become the most common type of virus in the UK. And that's because it transmitted between people much more easily than the other types of this virus. And that's now the most common one in the UK. Now, it does transmit between people more easily, but the evidence so far is that the vaccine works just as well against it, which is good. Other ones you might have heard there's the South African variant, there's the Brazil variant. All the time, we've got a huge team of scientists all across the world looking at this virus and checking, are there any changes in its genes that might make it a new variant? And we're following them to see, do they make them more transmissible? Do they make them more dangerous? At the moment, we don't have any evidence to say that these variants are less likely to respond to the vaccine. And actually, what is amazing about the new vaccines is that it's quite easy to change what's inside the vaccine to make sure that we can then recognize those new variants and tackle them. So should you be worried about the variants? No, not personally. There are people out there that are worried about them for you and are looking at them. And it might be that this becomes something a bit like flu, where each year there is a new vaccine made that just makes sure that we can keep on track of those new variants.
So the next question is now, does the vaccine contain animal products?
The simple answer to this is absolutely not. It's completely suitable for vegans, vegetarians, everybody, all cultures, all religions. Everybody should take this vaccine. There's nothing in it that would mean that you can't have it.
Does the vaccine affect fertility?
Lots of fake news circulating on social media recently about this, about whether or not it could. The short answer is no. And I have to be really clear about this. There is no evidence that the vaccine affects fertility. And we've had some really, really big institutions in fertility come out and support that and say that loud and clear. The the Royal College of Obstetricians, the Royal College of Midwives, the British Fertility Society, the Association of Reproductive and Clinical Scientists. Big powerhouses in fertility have come out and said, this does not affect your fertility. The second question is about what do you think the long-term psychological impacts might be of the pandemic? And Nick, I don't know if you could talk about what you might have seen in the practice so far that's already come up.
Actually, on an average day, I speak to probably about half a dozen patients who have been suffering with stress or anxiety or feeling quite low or even depressed. And it can make us feel suicidal, it can make us want to harm ourselves. And it's really, really important. And the one message is speak to somebody. On the screen, you'll be able to see here as well. You can access couth.com, which has access to free, safe and anonymous support. You can also access Young Minds Crisis, and you can text YM to 85258. And you can also access CAMS for mental health support, and the number's on the screen, and it's 0800 151 0023.
Make sure you don't forget to follow our Instagram, BarnetYouth_, for the latest youth news and events. And thank you so much to Dr. Elliott once again and Dr. Nick. You guys were great.